In our previous video, we discovered how health insurance plays a vital role in the U.S. healthcare system. We explored the three main ways people get coverage: through employers, government programs, or by purchasing private plans. We also highlighted an important fact: not everyone in the U.S. has insurance, and those without coverage often face high out-of-pocket medical expenses. In this video, we're going a step further. We'll take a deep dive into how the U.S. healthcare system actually works and break down the three main players: patients, providers, and payers, how they connect and interact with each other, why understanding this flow is crucial for anyone learning revenue cycle management or RCM slide. So now let us understand how the U.S. healthcare system works. The U.S. healthcare system is complex and operates differently from countries that provide universal healthcare. In the U.S., patients rarely pay the full cost of their medical services directly to hospitals, doctors, or other healthcare providers. Instead, payments are usually managed through health insurance companies or government-funded programs such as Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, and Veterans Health Administration services. According to the Centers for Medicare and Medicaid, according to CMS, the Centers for Medicare and Medicaid Services, the U.S. healthcare system mainly revolves around three important players who shape how care is given and how it's paid for. The first player is the patient, also called the beneficiary. According to CMS, or Centers for Medicare and Medicaid Services guidelines, a patient is an individual who is receiving or has received healthcare services, treatment, or evaluation from a healthcare provider, regardless of whether they are an inpatient, outpatient, resident, or client. In simple terms, anyone who seeks medical evaluation, treatment, or care from a hospital, clinic, physician, or any healthcare provider is known as a patient. A patient may be admitted to a hospital as an inpatient for treatment that requires staying in the hospital, or treated as an outpatient, receiving treatment without being admitted. As per CMS guidelines, patients have important rights, such as the confidentiality of their medical records and the right to participate in treatment decisions. At the same time, patients also have certain responsibilities. The first responsibility is paying insurance premiums if they are enrolled in private health insurance. Second responsibility is paying out-of-pocket costs such as co-payments, deductibles, and coinsurance. We will discuss these terms: out-of-pocket costs, co-payments, deductibles, and coinsurance later in detail. Third responsibility is providing requested documents to the insurance company whenever required. In short, patients receive the care, but they also share part of the financial responsibility for that care. The second player is the provider. In the U.S. healthcare system, a provider refers to any healthcare professional or organization that delivers medical care and services to patients. This includes physicians, nurses, hospitals, clinics, laboratories, pharmacies, and other licensed healthcare professionals or facilities. There are two main types of providers: 1. Individual, professional providers. These are people who personally deliver healthcare services. For examples: 1. Physicians, e.g., cardiologists, dermatologists. 2. Surgeons, who perform operations. 3. Nurse practitioners, NPs, provide patient care and prescribe medications. 4. Physician assistants, PAs, assist doctors in diagnosis and treatment. 5. Therapists, physical, occupational, respiratory, speech. 6. Chiropractors, treat spine and musculoskeletal issues. 7. Dentists, oral and dental care specialists. In RCM, these are often called rendering providers, the professionals who actually perform the service. 2. Institutional or facility providers. These are organizations or facilities where healthcare services are delivered. For examples: 1. Hospitals, general, teaching, or specialty. 2. Clinics, outpatient, urgent care, multi-specialty. 3. Skilled nursing facilities, SNFs. 4. Rehabilitation centers. 5. Home health agencies. 6. Laboratories and imaging centers. 7. Dialysis centers. 8. Hospice care facilities. In RCM, these are referred to as billing providers, the institutions that submit claims to payers for reimbursement. According to CMS, providers are responsible for diagnosing, treating, and managing the health needs of patients. They also generate and submit medical claims to payers, such as insurance companies or government programs, in order to receive reimbursement for the services they deliver. Providers play a key role not only in care delivery, but also in the revenue cycle process because accurate documentation, coding, and claim submission directly affect how payments are received. In revenue cycle management, RCM, providers are the starting point of the entire billing and payment process. Without providers, there is no healthcare service, no billing, and no reimbursement. Now, third player is the payers. In simple words, a payer is the group or organization that pays for healthcare services. This can be a private insurance company, or it can be a government program that is funded by federal or state money. Their main job is to make sure the cost of care is provided or reimbursed when a patient receives treatment. According to the Centers for Medicare and Medicaid Services, or CMS, a payer is any organization that sets service rates, collects insurance premiums, processes claims, and pays for all or part of the patient's medical bills. Now, why are payers so important in revenue cycle management, or RCM? Because after a provider gives care, they submit a claim. The payer then reviews that claim, decides whether it meets the rules, and determines how much money will be paid to the provider. A payer may be a government program like Medicare or Medicaid, which are managed by CMS. These programs are funded by federal and state money. Medicare mainly covers seniors aged 65 and older, along with certain younger people with disabilities. Medicaid mainly covers low-income individuals and families, including children, pregnant women, and people with disabilities. A payer may also be a commercial insurance company. These are private businesses that sell health plans to individuals and families, usually in exchange for a monthly premium, a regular payment made to keep insurance coverage active, or a payer may be an employer. Many employers provide their workers with group health insurance as part of their job benefits. In most cases, the employer pays part of the premium, while the employee pays the remaining share. In short, payers can be public programs, private companies, or even employers, but all of them play the same role, helping cover the cost of healthcare. So, what exactly do payers do? They review and process claims, they reimburse providers for the care delivered, and they create rules and payment structures. These rules define which services are covered, how much of the cost the payer will pay, and how much of the cost the patient must share. That patient share usually comes in the form of copayments, deductibles, and coinsurance, all of which we will explain later in detail. In RCM, payers are the key decision makers in the billing and reimbursement cycle. Their actions directly affect a provider's cash flow. Payer responsibilities are: the first responsibility is verify patient eligibility and coverage. Second is approve or deny prior authorizations for certain services. Third is process and review medical claims submitted by providers. Fourth is pay providers for covered services within a contracted time frame. Next is issue explanations of benefits, EOBs, or electronic remittance advices, ERAs, to explain payment decisions. And final is enforce compliance with CMS, HIPAA, and ACA regulations. In short, payers are the financial backbone of the U.S. healthcare system. They ensure that providers get paid for the care and services they deliver, and at the same time, they manage how much of the cost patients must share through things like premiums, copayments, deductibles, and coinsurance. Overall, in the U.S. healthcare system, patients, providers, and payers are closely connected. For example, patients seek medical care, providers deliver the care and submit medical claims to payers, and payers review those claims and reimburse the providers, while patients are responsible for sharing part of the costs through deductibles, copayments, or coinsurance. This relationship forms the foundation of revenue cycle management, RCM, where each step, from delivering care to submitting claims and receiving payments, must work seamlessly to ensure everyone gets what they need. patients receive proper care, providers are paid on time, and payers manage healthcare costs effectively. In the next video of this lecture, I'll explain the key healthcare terminologies commonly used in the revenue cycle management (RCM) process. As an RCM or AR calling trainee, it's important for you to understand these terms clearly because you'll come across them every single day while communicating with patients, providers, and payers. This knowledge will help you work more confidently and handle your tasks smoothly. Let's wrap up this video here. I hope you found the information about the U.S. healthcare system valuable and easy to understand. If you have any questions or doubts, feel free to reach out to me directly on my WhatsApp. You can also follow our WhatsApp channel or subscribe to our YouTube channel to stay updated with the latest insights and training content. I'll see you in the next video. Until then, keep learning, stay curious, and happy learning.